space with you up here. You don't mind, do you? Don't worry about it. Because it's hard with this mic, and I saw Larry do it, but I'm noticing to hold and to juggle and to raise a hand or a question is hard. But this plan, you are coming on effective new with the Maya Health Benefits Trust, effective July 1, 2014. This plan typically renews on a January timeframe. It is a federally subsidized plan. So, can I ask that cell phones go on vibrate if you don't mind? Unless it's someone famous calling and you want me to weigh in on the call. Thank you very much. Just a logistical thing. Appreciate that. So this plan renews January, but you're starting it in July. So the next communication for you regarding the plan would be in the fall. The fiscal year end for the federal government, does anyone know when that is? No, it's actually September. Yes, thank you. Someone said September 30th. So the rates and renewals for federal plans such as this Part D prescription drug plan will be announced in the fall for January 1st of 2014. So the rates in the plan that you have right now are obviously good for the next 6 months. We have been very pleased with the rates for this prescription drug pharmacy plan. They have been level or decreased for the past few years. So that's very promising. You are sheer volume. How many retirees do you think retire every day? Almost 10,000 individuals. So the rates on these plans, it's supply and demand. So someone asked a little bit about rating. Think of the Part D component. You are given one rate with the town. It's a medical and a Part D component combined together. It's two plans paired as one. It's a full replacement for your current plan. You may not have the medical without the pharmacy portion. So you will have MedX2 with this plan or Managed Blue for seniors with this plan, all right? So just letting you know that that's how it happens. You don't need to go out and sign up for a Part D plan. Please do not, and I'll let you know about communication regarding that, because if you did, you could not be on the town of Saugus' plan. You live in one world or the other. Do you have friends, relatives, family members who might have retired from another community or who aren't in the public sector? They have Medicare. They go out and buy a supplement to Medicare, right? And then they have to go buy prescription drug coverage. I work with family members on this privately, and some of those folks pay up to $570 to $700 a month to have their plans. So don't go ahead and buy another Part D plan. I don't want a cell phone argument between the couple on the right. So in terms of this, you don't need to go get one, and I don't want you to, because if you did, you would be on that plan, not this plan. So when we communicate to you and say you're with the town's plan as a retiree or spouse or surviving spouse, this is exactly where you'll stay. And as I said, the communication you receive now, the only difference that would be is for the fall time frame for the January. We might come back out again. We'll help with communication then, but I just want you to think about that, okay? And moving on and looking at the next 2 pages, I won't go through everything line by line. But I know your prescription drug benefit before. I believe it was a Part D plan, so some of you are accustomed to these co-pay structures and what it means to be on that. This actual benefit summary just gives you a little heads up, FYI, for your information with what it is and if you have other choices. I'm telling you, no, don't sign up for anything else. Comparing your options, you're comparing your medical options but not your pharmacy options.